Good morning, everyone. And thank you for taking your time out of your day to join us for this webinar that will present an overview of Medicare and discuss some sales tips and insight, as well as provide some exciting news about some of the resources that KAFL is excited to launch to be able to help enhance your business in the Medicare space and make doing business simpler and more efficient for you. During this presentation, I will discuss a lot of the costs of healthcare in retirement, what those costs consist of, give a high-level overview of Medicare to include Medicare Parts A, B, C, and D. Also, a very important topic as to when to enroll and certain enrollment periods that occur throughout the year, and the options that Medicare beneficiaries have to enroll in plans, whether that be Medicare Advantage plans or Medicare supplement plans. And also discuss some sales tips and conversation starters to help you start that conversation with your clients. I guess I should introduce myself. I am Robb Giambrone. I'm the new director of Medicare here at KAFL, and very excited to be part of a wonderful team here and to make this presentation regarding a very important topic in our country with regards to Medicare. The cost of Medicare can be quite staggering. According to the most recent study from Fidelity, indicates that a 65-year-old couple that retired in 2002 will spend a staggering $315,000 in their retirement years for healthcare. These costs can depend on personal factors such as their age at retirement, the number of years that they will live in retirement, and their overall general health. 44% of these costs consists of Medicare's out-of-pocket costs that will be discussed in more detail in this presentation. That will include, Medicare's co-payments, co-insurances, and deductibles for doctor visits and hospital visits. 39% of the costs are due to premiums for Medicare Part B, which includes doctor appointments and preventative care, and Part D premiums, which are for prescription drugs. And 17% of the costs are co-pays that one will pay for their prescription drugs, whether they be generic branded drugs or specialty drugs. Overall, the amount of money that you save for your healthcare costs in retirement really depends on one's risk level and how much coverage one would plan for. Medicare consists of 4 parts. Original Medicare consists of Part A, which is your hospital insurance, and Part B, medical insurance. Part C is more commonly referred to as Medicare Advantage, and Part D is prescription drug coverage. This slide demonstrates and shows the out-of-pocket costs for Medicare Part A. And I like to also describe this as the need for additional coverage, whether it be with the Medicare Advantage plan or a Medicare supplement plan. For Medicare Part A, there's a deductible of $1,600 for an inpatient hospital stay. So if one's admitted into the hospital right off the bat, they have to pay a deductible of $1,600. If it's a lengthy hospital stay and they're in the day for days 61 through 90, Medicare beneficiary will be expected to pay $400 per day and $800 per day for days 91 through 150, which are referred to as the lifetime reserve days. and beneficiaries are responsible for all costs per day beyond 150. It's important to note that a benefit period is a period that begins on the day that one is admitted to the hospital and ends when one has been out of the hospital for 60 consecutive days before it would restart. With regards to skilled nursing care, the first 20 days are covered by Medicare, but beneficiaries are then responsible for a $200 per day copay for days 21 through 100 and all costs beyond 100th day. It's very important to understand that in order for Medicare to pay for skilled nursing care, the beneficiary must have a minimum of a 3-day inpatient hospital stay. And it's critical that caretakers ask the hospital care team that their loved one is coded as being inpatient and not observation. It's well documented that beneficiaries have been billed upwards of $50,000 for a stay at a skilled nursing facility because the hospital stay, though one may have been in the hospital for 3 days, that it was coded as observation. As for hospice care, Part A will pay the out-of-pocket cost for hospice care consists of a copay of $5 per outpatient prescription and 5% of the Medicare approved amount for inpatient respite care. And beneficiaries are also responsible for their first 3 pints of blood if they were to need a transfusion. A couple other notes regarding Medicare Part A. Medicare Part A is premium free. That's what our Medicare taxes go towards. Premium free for those who have worked at least 10 years of Medicare covered employment for them, for that individual or their spouse. If one is withdrawing Social Security, they are automatically enrolled in Medicare Part A at age 65. If one has less than 10 years of Medicare covered employment, they can still obtain Part A, but will have to pay the premium. The premium would be would be substantiated for the amount of months that they did work in Medicare covered employment. Moving on now to Medicare Part B. Medicare Part B is your medical insurance, which also refers to a lot of, it's all your outpatient care. Medicare Part B has really done an excellent job of enhancing its preventative services that it provides, diagnostic tests, certain therapies, and durable medical equipment. For a complete listing of the services that are paid for by Medicare Part B, you can refer to the Medicare and You Guide, which I'll share with you later on in this presentation. With Medicare Part B, some of the costs involved is $164.90 is the base premium and what most beneficiaries will pay for. However, as demonstrated in the next slide, higher income earners will pay a higher premium for their Medicare Part B. For those that don't enroll in Medicare Part B when they should, they will be assessed a penalty. Penalty is 10% for each year that they did not have Medicare Part B, but could have had it. Medicare Part B consists of a $226 deductible and a 20% coinsurance. And these amounts can change or will change every year at the start of the new year. As I mentioned, higher income earners will pay more for their Medicare. This chart demonstrates those amounts and the thresholds that correspond to those amounts. And again, if anybody has any questions regarding these, please just feel free to enter those questions into the chat function on Zoom, and I'll be sure to address questions at the conclusion of the presentation. As many of you who are selling Medicare are familiar, Part C is Medicare Advantage. Consists of HMO plans or PPO plans, private fee-for-service plans, or specialty plans, like a dual special needs plan for those who are Medicare and Medicaid. There's chronic special needs plans for those who have chronic conditions as defined by Medicare. With Medicare Advantage plans, the cost can increase if you were to use out-of-network doctors. And it's important to note that Medicare Advantage plans, they must cover all Part A and Part B costs. And one of the main highlights of Medicare Advantage plans is that they offer additional benefits, like combined with prescription drugs, or they offer hearing, dental, and vision that are not covered by original Medicare, but can be covered in a Medicare Advantage plan. Here at KAFL, we're very excited and proud to be able to offer a strong portfolio of top carriers in this market. Regional carriers here in Western New York to consist of Excelis or Univera, Highmark, and CDPHP. With carriers that are available nationwide, United Healthcare, Aetna, Humana, WellCare, and Anthem. If there's a particular carrier that is especially competitive in your area, don't ever hesitate to ask, and we can consider to see how that would work into our portfolio. Medicare Part D is prescription drug coverage that is run by private insurance carriers and again must follow rules set by Medicare. They can be standalone plans and most commonly combined with the Medicare Advantage plan. Medicare Part D prescription drugs cover the costs of retail drugs distributed throughout pharmacies and are divided into specific tiers, 1 through 6. Tier 1 being your generic drugs, tier 2 being your brand name generic drugs. And as you get into higher tiers, you can expect to pay a higher copay or a certain percentage of coinsurance. With tiers 5 and 6, they're really specialty drugs for more serious health conditions like cancer. Prescription drug plans use preferred pharmacies, where if the beneficiaries are using a preferred pharmacy, they'll pay a slightly lower copay than if they were to use a non-preferred pharmacy. That copay is not drastically different, but it does save a little bit of money when using a preferred pharmacy. And also, if one does not enroll in Medicare prescription drugs when they should have, enrolls later, they will be subject to a late enrollment penalty that is 1% of the average national premium, which is $32.74 in 2023. And this will be assessed for each month one didn't have Part D prescription drug coverage, but could have. And prescription drug plans started in 2006. So for beneficiaries that may have never had a prescription drug plan, and now are looking to get into one, and they may have been Medicare eligible since then, the late enrollment penalty would have begun calculating at that period in 2006. One other point to mention is that with regards to prescription drug premiums, again, those with a higher income will pay more for the prescription drug on top of what the premium is assessed by the specific carrier. Another option for Medicare beneficiaries to help them pay for Medicare's out-of-pocket costs are Medicare supplement plans. With Medicare supplement plans, the premiums cost can vary by insurance companies and the state. With Medicare supplement plans, beneficiaries have the flexibility to see any doctor who accepts Medicare anywhere in the country. If they don't provide any additional coverage for dental, hearing, or vision, for those that wanted those benefits, they'd have to buy standalone policies that are available if they're available in your state. And again, Medicare supplement plans don't provide any prescription drug coverage, but again, Medicare prescription drug plans can be purchased and sold as standalone plans as well. Medicare supplement plans consist of 10 standard plans offering different levels of coverage, but each plan provides basic benefits to include the Part A coinsurance of $1,600 and hospital costs up to an additional 365 days after Medicare benefits are used up. So as was demonstrated, and I mentioned previously, that original Medicare for Part A, there is those lifetime reserve days of goes up to 150. If one were to be in the hospital past 150 and they had a Medicare supplement plan, that Medicare supplement plan would provide an additional 365 days of hospital coverage for that beneficiary. It's important to note that as of 2020, Medicare beneficiaries who were Medicare eligible prior to 2020 can still purchase Plan C and Plan F. Those who are newly eligible for Medicare after January 1st, 2020 aren't able to purchase Plan C and F, since Plan C and F pay for the Part B coinsurance of, the Part B deductible rather, that again, this year is $203. So also Plan F and G also offer a high deductible plan in certain states. With this option, one must pay for Medicare covered costs up to the deductible amount of $2,700 before the policy will pay all costs. With regards to Medicare supplement plans, again, Medicare supplement plans are a more competitive option outside of New York State. With New York, there's a benefit of those who do enroll in a Medicare supplement plan. They can enroll at any time of the year and not be subject to any underwriting, which is unlike most other states. With other states, rates can depend on gender, tobacco usage, their zip code, as the rates do here in New York as well. Certain discounts that are available, discounts can be up to 14% household discount that does not require the spouse or the partner that they've been living with for at least 1 year to be a policyholder with that particular carrier. And Medicare supplement plans in most states are going to be underwritten outside of that 6-month open enrollment period or a guaranteed issue period. As for costs, you'll see a Medicare supplement plan G, which is the most commonly purchased plan, cost around $240 or more in New York, depending on carrier. As with regards to other states, you'll see Medicare supplement plan G premiums can be as low as $100 when the 14% discounts are calculated. So they are competitive options and can certainly provide information on any of those carriers to anybody that has any questions regarding those options for their clients that are outside of New York. With regards to plans in New York State, AARP is an option, as well as Excellus and Aetna, and United American or Globe Life is another very competitive option for Medicare supplement plans in New York State. Here, this chart just kind of gives you side-by-side comparison between Medicare supplements and Medicare Advantage plans. With regards to one of the main highlights of a Medicare supplement plan is beneficiaries really like the freedom to choose their doctors and know that they're can be covered anywhere in the United States. However, with Medicare Advantage plans, they're generally lower premiums, even 0 to very low premiums with copays and maximum out-of-pocket costs. They include prescription drug benefits. And they can include additional benefits as mentioned, like vision, hearing, or fitness. One of the key aspects and the most important things for brokers to know when talking to their clients about Medicare is when they can enroll. To enroll in Medicare Parts A, B, C, and D, most commonly can be enrolled during their initial enrollment period, which is 3 months before their 65th birthday, the month of, and 3 months after, for a total of a 7-month period. If beneficiaries are already receiving Social Security payments that they can get as early as age 62, again, they're going to be automatically enrolled into Part A and Part B when they turn 65. It's most common that they will accept the Part A coverage because it's premium free. But if they're still working, which many are still at age 65, they can decline Medicare Part B and then enroll in Part B anytime while they are on that employer group plan, or an 8-month period after they leave that group or are retired, whichever occurs first. Or I should say whether 8-month period, whether they lose that group insurance or retire, whichever comes first. There's also the general election period. For those that missed their Part B initial enrollment period, they can enroll during the general election period, which is January 1st through March 31st of each year, with coverage effective the first of the following month. Again, a penalty would apply if they were to enroll during this GEP. One of the main enrollment periods that many are familiar with is the annual enrollment period, which is October 15th through December 7th of each year, when existing Medicare beneficiaries can make changes to their MAPD or prescription drug plans. They can enroll in new plans, disenroll from their Medicare Advantage or prescription drug plan, and go back to original Medicare. And then if they choose to disenroll and go back to original Medicare, they can also then enroll into a standalone prescription drug plan using a special enrollment, using that OEP election. And they can also enroll in a Medicare supplement plan. Again, that's going to be guaranteed issued in New York State, but in other states, it would likely be that Medicare supplement plan would likely need to be underwritten, and they would need to be approved before they would disenroll from their Medicare Advantage plan. For those that are enrolled in a Medicare Advantage plan at the start of the year, it's important to note that they have the Medicare Advantage open enrollment period, which is January 1st through March 31st of each year, when those enrolled in the Medicare Advantage plan can make a one-time switch to another MA plan, disenroll from that MA plan, and go back to original Medicare and enroll in a standalone drug plan. But they have to be enrolled in a Medicare Advantage plan beginning January 1st. And also there's special election periods that pertain to Medicare Advantage and prescription drug plans, which are a certain period of time when one can enroll in another MA plan or a prescription drug plan outside of their initial election period or open enrollment. Most common special election period would be the loss of employer group, or a change in Medicaid eligibility, or if somebody was in their trial right for a Medicare Advantage plan. So when you're in a Medicare Advantage plan, you have a 1-year trial right. If it's your first time in that Medicare Advantage plan, you can leave that Medicare Advantage plan at any time during that first year and enroll in another Medicare Advantage plan, or go back to original Medicare. And in that case, the Medicare supplement plan would be guaranteed regardless of the state that you reside in. And there are also several other different special election periods that I could be glad to share with you at any time. Now, for an overview, a high-level overview of commissions and how the Medicare market can be very lucrative for producers. Because with Medicare commissions, it's all about the renewals and how one can build their income through a renewal stream. A lot of times, advisors who have been in, selling life insurance, financial planning, maybe P&C producers, they've been doing that a lot for the majority of their career. And then they realize that, they have friends and colleagues and clients that are nearing Medicare eligibility, and they start selling Medicare, and will use that renewal income and their Medicare commissions to really go, help them build their retirement savings. Producers that I've worked with have also made it a plan of theirs to set aside and make it a certain goal, like to make enough in Medicare commissions to have a certain goal, like to pay off their mortgage. So they want to make enough in renewals so that every month their renewal premium is going to pay for their mortgage, or some sort of expense like that. So those are good goals and good benchmarks for producers to set aside. And with Medicare advisors, not being Medicare not being a primary source of their business, again, these commissions are a tremendous source of supplemental income and revenue towards your main business. As for the some specifics regarding commissions within regards to New York, United Healthcare AARP can pay $400 for a Medicare supplement plan in year 1, $270 years 2 through 6. Excellus is paying $100 for the life of the policy. And then Mutual Omaha is paying a smaller amount for Medicare supplements at 6.5% year 1, 4.75%, then for the life of the policy after that. In most other states, you're seeing an average commission of 22% years 1 through 6, and 5% years 7 through 10 for new business. Medicare Advantage commissions are tremendous, with the first year commission being $601 in 2023. I look forward to learning what the 2024 commissions will be. It will be announced usually around, this summer. So July or August, usually. And that first year commission is payable on anyone who is enrolling into a Medicare Advantage plan for the very first time. If someone's replacing their Medicare Advantage plan, it pays $301. And then renewals payable for life of the policy are $301 as well. And it's important to remember that with regards to Medicare Advantage, of course, certification is going to be required, not only to just sell the plans, but also to earn your renewal commissions as well. KAFL is very excited to be committed to this Medicare market. We are committed to be your main source for all things Medicare, to help you provide more value to your client relationships and help you make more money. As some of you know, KAFL is now an ICON affiliated agency. A leading factor in joining forces was to enhance the services that we can provide in the Medicare space with access to some of the top tools in the industry, like Agent Accelerator, Sunfire Matrix, that is a instant Medicare Advantage and prescription drug plan recommendation tool. So you have the opportunity to enter your client's prescription drugs and their healthcare providers, and it will tell you which plan is most going to best meet their needs and the lowest cost plan available for your client to recommend. There's also going to be access to instant quote tools, like through the CSG actuarial quote tool that'll be available on the Agent Accelerator platform. That's an excellent instant quote tool. That's just simply putting in your client's age, zip code, gender, and tobacco status, and it'll provide you with a quote. It's excellent for Medicare supplements. It has a dental options on there, final expense as well, and very efficient way to provide your clients with an instant quoting capabilities. Also, a new lead program that we'll have available is LeadStar Marketplace that will provide you the opportunity to get leads that are, you can either have the option of just getting names of prospects that fit that demographic, or you'll have the option for live transfers. So if you were to be available, say, for a couple of, 2 hours on a Thursday afternoon, any live transfers will be transferred to you of consumers that are looking for Medicare plans during that time. We're working out the final details on how this would become available, but it will be a program that will be available to our brokers, and we're very excited to be able to launch that in advance of this year's Medicare enrollment period in the fall. Now for some sales tips and marketing insights. Of the 10,000 baby boomers that are turning 65 every day in our country, many of them may be your clients who have come to trust you for other important insurance and financial coverage. They trust you for some of their most important matters, like homeowners insurance, maybe even auto insurance or investments, and will welcome the opportunity to receive guidance on their healthcare costs in their retirement years. One very important statistic that has been commonly referred to was a study from AgeWave in conjunction with Merrill Lynch back, I believe, in 2017 or 18, that said less than 15% of pre-retirees have someone that they know that they can trust to ask about Medicare and its costs and what they need to do to plan for it in advance of retiring. And it went on to say that it's not that they don't have those people in their lives, it's that the people that they do know are not marketing to them or telling them that they can, in fact, they do have a health license and they could, in fact, provide guidance to them on Medicare. As discussed in the beginning of this presentation, it's really important that advisors advise and educate their clients on the cost of healthcare and retirement, with the average lifetime cost for healthcare being at $315,000 in 2022 for a couple that's retiring at age 65. And this number can jump to nearly $395,000 when dental, vision, copays, and other out-of-pocket expenses are included. Just a common question to ask and state to your clients is, I can help you provide protection against these high out-of-pocket costs. It's important that advisors move their focus from helping clients accumulate wealth to helping them preserve and protect it. As part of the Medicare conversation, you likely know your client's age, but probably maybe unsure of their healthcare coverage. Some important questions to ask in regards to your health coverage. Are you self-insured? Do you have a Medicare Advantage plan or a Medicare supplement plan? And as the advisor, you can state, I can help lessen your burden of determining the health coverage you need and guide you in choosing the Medicare coverage that best meets your needs. For those that are focusing on financial planning throughout their career, you've been providing life insurances or annuities. Who do you want advising your clients on their healthcare costs? So be sure to inquire on their health needs and don't risk losing out on this business. Several times throughout my career, I've worked with advisors who have come to a realization that they needed to be talking to their clients about Medicare because they had lost clients, their entire book, whether it be a property and casualty agency. Not only did they lose a client for their Medicare coverage, but they lost their P&C business as well because they went to somebody that was able to encompass all parts of those needs to help cover those costs. To help determine what your clients are spending and what they have saved for coverage. When meeting with your clients, it's really important to do a kind of a cost analysis between what certain plans would cost and what their benefits are. If one is determining between whether staying on a group employer-sponsored coverage or going on to Medicare, it is very important at that juncture to do a cost analysis as to what is being paid by the Medicare beneficiary / the employer at that employee at that time with regards to premiums and what their maximum out-of-pocket costs are going to be on their healthcare coverage. Does their healthcare coverage with their employer, what does it pay for prescription drug coverage? And just determining and analyzing those different options for your clients. And it's important to know that, of the options available being with Medicare supplement or Medicare Advantage plans. And some of the important questions that you can ask your clients are, do you travel often? If they travel frequently, there could be some concerns about if they use Medicare Advantage plans, which doctors are they going to see when they travel to another area? While almost all all carriers now have reciprocity with other networks as long as they have plans in those states. Sometimes Medicare beneficiaries can feel like that's a burden to have to coordinate that, and so something to take into consideration for them and when determining what coverage is best. It's always important just to steer the conversation for your clients. And I always encourage brokers and advisors to take any biases or preconceived notions that one may have about coverage when presenting them to their clients, because certain plans may suit others better than what's available than what you believe is to be the best option. So just always go in with an open mind. With Medicare, I like to refer to that one of the main differences between Medicare Advantage and Medicare supplement plans is with a Medicare supplement plan, the beneficiaries are paying for their healthcare coverage in monthly premiums, whether they're going to use their healthcare coverage or not. With Medicare Advantage plans, beneficiaries are mostly only paying for their healthcare coverage when they use it. So that's an excellent comparison of the two plans, and a great advantage for Medicare Advantage plans, knowing that they're capped at a certain maximum out-of-pocket cost, which beneficiaries rarely hit. When talking to the clients about the plans, be sure to get a list of all their prescription drugs to include dosage and frequency, and the names of the Medicare providers and network affiliations to be sure that the plan that you're recommending covers the drugs that they need in an affordable means, and that the doctors that they're using are in network. Be sure to not only ask for their primary care physicians, but also any specialty doctors like a cardiologist, a neurologist, making sure that all of those doctors are in the network for that specific carrier. Medicare is all about a trust sale. People buy from people they trust. And it's important to build upon the trust that you've already established with your clients. And you don't need to be the expert with regards to Medicare. Just knowing the basics discussed in this presentation can give you the knowledge and confidence to help you make sense of Medicare for your clients. And when marketing Medicare and starting a Medicare marketing plan, it's important that you don't just market to people who are nearing 65 or pre-retirees. I always encourage producers, whether or not if you have a 40-year-old client who has trusted you for life insurance, maybe your property and casualty needs, you're working with a 40-year-old client to help that client invest their money in saving for retirement. That client will certainly want to refer you to their parents or their loved ones and friends for Medicare guidance. So just be sure to always mention to your clients, regardless of their age, that they know that you can be a trusted source for Medicare. When talking about Medicare to your clients, you're adding tremendous value to your client relationships. If you were to sell just one policy to your client, you risk losing that client. The more policies you sell to your client, the better opportunity you had to retain them for many years. It's really important to understand the bundle concept. PNC carriers and their agents have mastered this bundle concept. They're not just offering you home insurance, but they're offering you coverage for your cars, your boats, and other important assets. And they're even talking to you about life insurance, but why not Medicare too? So be that one-stop shop for all their life and health insurance, as well as the additional products that you have become an expert in throughout your career. And again, each additional policy you sell dramatically increases your client persistency and the retention of your clients and puts more money in your pockets. As we begin to wrap up this presentation, one important part to highlight is to be sure you're asking your clients the right questions. Like, how do you pay for dental care? Are your final expenses taken care of so not to burden your loved ones? What happens if you get cancer? And are you insured in the event you would be confined to a facility? These are common needs among seniors. And a dental policy, a critical illness with cancer coverage, or a final expense plan are all products available here, top carriers available here at KAFL. And just asking these simple questions will again strengthen the relationships that you have with your clients, lead to more sales, and again help you make more money. Because if you don't know how to ask the right question, you discover nothing, as stated in that quote on that page. Now that you've had the Medicare conversation with your client and you got them listening, now what? What are some of the best ways to help seal the deal? You can focus on brand recognition of the carrier that is going to be the best option for your client, the financial strength of that carrier, or the customer service it provides. It's important to ensure the business transactions. Simple e-applications of Medicare Supplement and Medicare Advantage plans that we will have available through some of our new technology that we will unveil. And be sure it's a smooth process for your clients. When you're doing an electronic application, there is almost instant underwriting available, and policies can be issued very quickly. And when the policies are submitted electronically, the key point of that is that the applications are assured to be submitted correctly. You can't submit an e-application with mistakes on it unless you were to like mistype a number or whatever. But if you were missing information, you can't submit an application with a certain field left blank or a box that might have been unchecked. The e-application will alert you to that you missed answering a question. So it's very efficient to making sure that the applications are submitted correctly and then being issued more quickly as well for your client. And as always, be sure that your clients complete the scope of appointment form and adhere to other CMS regulations regarding call recordings and disclaimers. In conclusion, the Medicare conversation is not a difficult conversation to start. Knowing the basics of when to enroll and the options available and what it's covered is extremely valuable in today's market. And it's okay to say, I'm not sure, but I'll get back to you. You can always call, text, or email me with your questions. And I'm glad to answer any questions and provide marketing plans, help you establish marketing plans, and provide you with lead generating ideas, affordable lead generating ideas on how to generate leads organically through your community and through your relationships that you have throughout your community. Whether you maybe be part of like a Rotary Club or your church or other affiliations that you have, those are excellent ways to build referrals, build leads, and build a stream of clients that will come to trust you for their Medicare coverage. So with that, I will be glad to answer any questions. And I'm going to check the questions out now there in the chat. So with regards to the prescription drug penalty, yes, if someone does not get a prescription drug plan at age 65 when they're eligible, or if they don't have a special enrollment period to enroll in a Medicare Advantage plan, or excuse me, a prescription drug plan, and they eventually do, yes, they're going to be penalized 1% of that average national premium, which this year was $32.74. They're going to be assessed that for every month they did not have a prescription drug plan, but could have. There are carriers that have really catered to those particular clientele with low cost prescription drug plans, low premium plans, as low as $7 a month. I know SilverScript has a plan like that. WellCare has affordable, very low premium options. Some of the carriers that do offer those low cost prescription drug plans, however, are not paying commissions on those because they are such small premiums. But yeah, those options are available to put your, as kind of like prescription drug placeholders, just so clients can have them so they can avoid any penalties should they need a prescription drug plan later on. Yes, with regards to the size of the group plans, yeah. So if the size of the group, that the employer group would be over 20 lives, that means that the group plan would be primary and Medicare would be secondary. If the employer group is under 20 lives, Medicare is primary coverage. So they would need to have Medicare if they were on a group plan under 20 lives, should be enrolled in Part B and Part A. And it's important to note that in those situations on a small group plan under 20 lives, that with that small group plan being secondary, they pay as if the employee at that time had primary coverage. So if they, let's say they didn't have Medicare, but they were on employer group plan that was secondary, that employer group plan is only going to pay. So Medicare would pay it like for prescription for Medicare Part B expenses. Medicare is supposed to pay 80% for the hospital, or excuse me, the doctor visits, and the out-of-pocket cost be 80%. So, but then the secondary insurer, that in this case being in a small employer group, they would only pay 20% because they are expecting Medicare to have paid the 80. I'm just reading a couple other questions. For someone who you're turning 65 this fall, and your wife spouse is still enrolled into an employer group plan, you can remain on that employer group plan as a dependent on her plan, and then enroll in Part B. You may want to consider getting Part A now if it's available to you, but you don't need it. If you do stay on the employer group plan as a dependent, you will have a special election period to enroll in Medicare Part A and B, C and D for that matter, after coming off the employer-sponsored plan. So the Part B premium are announced in the fall for the coming year. It seems, I've always, throughout my career, would always expect it to be before Medicare annual enrollment period kicks off on October 15th, as that's when beneficiaries have to start making their elections. But for many years, it wasn't until November, but I have in more recent years have seen it, that Part B premium and like the average national premium for prescription drug plans is announced in early October, when your clients are receiving their annual notices of change for their Medicare Advantage plans that they may be insured on. So you can look for more webinars coming up from our carriers, and most importantly, for important webinars regarding some training on the new technology that we will roll out to really help enhance your Medicare business and making it simpler for you to do business. I appreciate the questions that still are coming in. Someone's on employer plan and has Part A. Any copay they pay on the employer plan used toward their that would depend upon whether or not that employer plan was primary, or so if the employer plan is primary, usually they don't coordinate with Medicare, so it would not go towards any Medicare costs. So if one's on an employer plan, it's best and usually most recommended that they do not enroll in Part B, and then enroll in Part B when they would be coming off of that group plan. There's been several cases that I've come across where someone is enrolled in Part B at age 65 because they're 65, they think they need to enroll, they received some, they were misadvised on what to do, and they've been paying the, in this case, $164 premium. I've had cases where they've been paying that premium for 6-7 years, and that a claim had never been filed because the employer group plan was primary coverage, and Medicare never was involved with the options to pay additional costs. So it's important that your clients know the options available to them and when to enroll. And again, for all your specific questions that you have on this, please feel free to reach out to me. I look forward to being your trusted source for all your Medicare needs that you can pass on to your clients. And again, feel free to call, text, or email me at the information you see there on your screen. And look forward to reaching out to all of you and earning your business going forward in this Medicare market. So thank you again very much for joining me this morning on this presentation, and look forward to working with you further. Thank you.